Welcome everybody. Thanks for coming in person and welcome to those online who are joining us. Really excited to welcome Professor Chao Ren. So Chao and I have known each other for a few years now. We're both on the management committee for the Global Heat and Health Information Network, which is co-convened by the WHO and the WMO. And so I think this is the second time that she's come to see us in Sydney.
Okay.
It's the first time we've got her to give a talk, so thank you. So just a brief introduction. So Chao is Professor in the Faculty of Architecture at the University of Hong Kong. She specialises in applied climatology and climate-responsive urban design. Her research uses GIS, spatial modelling and remote sensing to examine urban environmental performance and develop strategies for healthier, more climate-resilient cities. So in this presentation, Chao will share her insights from Hong Kong on the impacts of extreme heat in high-density urban environments, including the urban heat island effects, heat health risks, and climate-responsive planning and design approaches. So just before we begin, I'd just like to recognise and pay respects to elders past, present, and emerging of the lands that the University of Sydney lies on, which is the lands of the Gadigal people of the Eora Nation.
Thanks, Ole. Hello, everyone. Thanks for having me today at Sydney University. It's really a great honor to give a presentation. First, before I formally start my presentation, I would like to let you know the cover page is not made by AI or Photoshop. This is a real situation in Hong Kong. So now we are talking about high-density city. Although Sydney is also a MEC city, but its city context very different from ours. So for today's topic, I would like talking about how we beat the heat, how we understand the heat patterns, and also work with the government and also the NGOs to do this kind of real implementations. Oli already briefly introduced myself. Basically, I work on this applied climatology and also urban scale climate change and health. In 2023, UN Secretary he mentioned that the era of global warming has ended, and then now we enter a new era, which is called global boiling. And so he made such kind of announcement in 2023. Well, 1 year later, we got this kind of new record. We cannot really limit our global temperature rise within 1.5 degree limits. So now we are approaching a new age, a new era. But the problem is, this is at the global level. This is very famous graphics to show if we have such kind of small shift in average global temperature, actually it can result in exponentially this kind of higher probability of the record-breaking weather extremes. So you can see that for the new climate, it means we'll have more hot weather and more extreme records of the heat waves. And a few years ago, during the COVID, everyone worried about this kind of infectious disease. But however, the Columbia University, they published a global report. They mentioned that such kind of rising temperature will cause more deaths than all infectious disease. And especially because such kind of new temperature records will cause particular devastation in the poor, hotter part of the world. So that is why we need to understand the risk and also investigate to mitigate such kind of risk. And this is a news article report in 2015. It's talking about in Hong Kong, how the poor families struggle to keep cool at home. The problem is the outside temperature for Hong Kong, the highest temperature is only 33 degrees Celsius. Well, when they conduct a measurement indoor, they found that the temperature actually indoor, 80% of the time is higher than outside. And the highest one can reach to the 42 degrees Celsius. And so that is why the mom have to shower her daughter 3 times per night. And the whole family have to stay at McDonald's because there is air conditioner. So that is why they have to went back home only around midnight just for sleep, but barely they can sleep very well. And so in Hong Kong, we have this kind of city context. The first challenge is aging society. By 2040, 1/3 population will be elderly people, their age above the 65. And then we have this kind of neighborhood poverty issue. Although Hong Kong GDP is very high, but the problem is the social demographic disparity and evenly distributed in Hong Kong. So some districts, they are famous for this kind of very poor family, the low income family. And then this is Hong Kong. Okay, we have a high density built environment. And the problem is, apart from the global warming, this kind of high density built environment also can cause high UHI effect and also the temperature rise. According to local weather records, the temperature rising speed is faster than the global one. Well, for the wind environment, we have a relatively less wind, and this kind of situations continue. So previously, I mentioned at the global level, we have a global temperature rise about 1.5 degrees Celsius. But what does it mean at the city level? So if you refer to the local, this kind of definition about very hot days and hot nights, and also cold days, you can see, according to our local historical data, around the early 20th century, every year we have this kind of very hot day and hot night situation. We still have so-called cold days. However, for the last 3 decades, you can see the hot night, very hot days dramatically increase, while the cold days decreased. And if we run very simple calculation, from the early 20th century, the mean value for per year is roughly 1 hot nights and 2 very hot days. And for the extreme hot days, i.e. the daily maximum temperature above or equals to 35 degrees, less than 0.7. Well, for the last 3 decades, you can see the increasing numbers of the hot nights is 42 times, while for very hot days, it's 9 times. But for the recently, last few years, this situation going very crazy situation. Okay. And in Hong Kong, we also have a lot of this kind of public health research results. And typically, when we talk about heat health impact assessment, people were talking about behavior change, mild symptom, discomfort, help seeking, like the clinic attendance, hospital admission, and then eventually go to the death. So very often, because I guess most audience here are from the public health, you are very familiar with this kind of conclusion. When temperature rise by a certain degree, they will associate a certain percentage of this kind of mortality risk or morbidity risk. But the problem is, if you show this kind of result for the architect, for the policy makers, or even for the NGOs, basically they can do very little things, because they want to know where is it, how is this problem caused, and what is the population situation, right? So that is why in 2019, we conduct this kind of big, large team interdisciplinary research. So we focus on the climate change, urbanization, and also aging. And for this research, it's a very special one because our Hong Kong Research Grant Counselor asked us to partner with non-academic people. So for example, for the task 1, for the climate data, we not only statistically downscale the data, but also we need to get this kind of urban scale data set for weather information service, heat health impact assessment. And our partner is Hong Kong Met Office, Hong Kong Observatory. And then we also work on the built environment. Our partners from the Planning Department, Housing Authority, Built Department, and we conduct the outdoor understanding, but also conduct the measurement indoors, so we can create this kind of guidelines for urban planning design for the extreme weather. The last part is talking about service support. So we partner with NGOs, Hospital Authority, Environmental Protection Department. We create this kind of adaptation strategies to support our elderlies. And from the team members, we got people from nursing, from the Institute of Aging, from the public health, and also from the building energy, architecture, urban planning, mechanical engineering, environmental science. So it's really multidisciplinary team. For today's research, I will focus more on the climate part and also the health impact, because I work on that part. And as a scholar, every time when we do the research, the first step is we do the literature review. And so we check the Web of Science, the paper's publication. You can see if we type in the heat wave and heat risk, so there is a dramatically increase in terms of the publications, okay, from the 1990 up to now. And when we done that, it's around early 2020, but now I'm pretty sure that this line will continue going up. And if we run very quick this kind of machine learning studies about the literature review, they show this kind of hot topics like the urban heat island, surface temperature, the climate change, small comfort, urbanization. But if we dive into those literature papers, we can find that people often talking about heat waves. They think about globally, but more important, can we do the real action at the local level? And unfortunately, there's a very limit this kind of real cases. And second one is, if you read the report, global report, like the IPCC report, very often they mention the UHI is quite important, i.e. the urban heat island effect during the heat wave. And people need to understand the spatial temporal pattern and also the situation during the daytime and nighttime. And when they conduct this kind of heat-related house impact, surprisingly, you can find many often for the large-scale study or global study, they rely on the land surface temperature, not air temperature. Very little this kind of air temperature-related mortality or mobility risk analysis. And also because there's no universal definition for heat wave, so that is why we need to conduct the local analysis study to try to detect the hotspot and also hotspot definition. The last one is about heat risk implementation. And it's not just a talk about the hazard. We also have to understand the exposure and also the vulnerability situation, so we can get a comprehensive understanding of the heat risk and also talk about a potential implementation. So our journey starts from the conversation with Hong Kong Observatory people. And the first question from our meeting or discussion is, how can we define this kind of local definition of the heat wave for Hong Kong? Hong Kong's climate is subtropical climate. It's very different from here. And so the first one is we want to evaluate the impact of the different types, lengths, occurrence timing of the extreme hot weather on all-cause mortality, and also to identify the different interactive effect of extremely hot weather conditions between the daytime and nighttime. And then we can determine vulnerable populations. And then we can finally suggest this kind of typical heat wave definition for Hong Kong case. And so we test the different lengths, like the consecutive very hot days, 1 to 2 consecutive hot days, and also testing the occurrence timing and also the combination of very hot days and hot nights. And then surprisingly, we found if we just have a single hot night, the mortality risk, roughly speaking, is around 2%. And then if we have 5 consecutive very hot days, the mortality risk increased to 4%. Well, for the consecutive hot night, surprisingly, this situation will double the consecutive very hot days. And then we also running this kind of combination. So based on this analysis, we suggest in Hong Kong, local heat wave definition could be at least 2 very hot days and 3 hot nights in between. And then this mortality risk will be around 5%. For this combination, we also consider the weather forecast capability of Hong Kong Observatory and also lag effect. So that is why eventually after discussion, we decide to use this one. And then we also identify the female and also the elderly people. They are the vulnerable population. For this one, actually, we published paper in 2019. By that time, we found that the most documents, reports, findings talking about the daytime heat. But for us, actually, surprisingly, we found that actually nighttime heat will kill more people. And I guess probably the reason for this one is Hong Kong located in the subtropical climate. The daily diurnal temperature difference is very small. Here, your daily maximum temperature can go up to 40 degrees something, right? But for Hong Kong, it's like the 35, 33 degrees Celsius. But for our nighttime temperature, normally stable around 28 degrees Celsius. So you can see the diurnal temperature difference is like a 4 or 5 difference. but for yours can up to 20 degrees something. So it means the body in the nighttime, it can be recovered because it's a temperature difference. But for us, it's constantly high, the temperature. So that is why you cannot sleep well. You cannot go to this kind of deep sleeping quality. Yeah. So that is why this finding is very, very, very special. So the consecutive hot nights can cause a higher mortality risk than the consecutive very hot days. And then the second question is, so now we know the nighttime can kill more people. How about the spatial temporal patterns? Are they the same? And before we conduct this study, everyone thought now we during the daytime we see the sun, the big sun, and we have a high temperature. So the daytime could be issue. So then we conduct this kind of geospatial analysis and investigate the spatial pattern of very hot days and very hot weather conditions for both daytime and nighttime. And also we determine the factors of built environment potentially contributing to the spatial variability of the extreme hot weather. So we can provide this kind of recommendation for planning design. And for this one, we use air temperature data from the 40 Hong Kong observatory stations. And also we use the land use regression model to generate this kind of spatial mapping of very hot days and hot nights. We also consider land use road network morphology populations. And then we can see for very hot days, the most of the time, the hotspot area located in the rural area of China, Hong Kong. Well, for the hot nights, it's mainly observed in the downtown areas, especially those high-dense urban areas. You can see the locations are very different. So once we show this map to our government, they realize for the daytime, for those kind of construction sites, the outdoor labors, they should be worried about. Well, for the nighttime, they should worry more about the downtown areas. So based on this, we also provide recommendation like the improving urban ventilation and greenery mitigation to mitigate this kind of extreme heat situation in the downtown areas. And based on that study, we run the extreme heat risk mapping. And because we want to develop this kind of localized integrated extreme heat index, including the weather conditions, population exposure, vulnerability, but also we want to map out the spatial pattern and temporal trends of the daytime, nighttime heat, and also identify the hotspots and also their latent contributors. So we have done this heat hazard map. We can detect this kind of changing patterns from the 2006, 11, and 13. And you can see the area of the hotspot heat hazard is getting bigger, no matter for daytime and nighttime. And also we can find out the heat exposure situation and also vulnerability situation. And later we combine the three understanding from the hazard, exposure, vulnerability, we generate heat risk. And for this map, it's very easy, simple way. We just overlay the nighttime heat shelters provided by our government, this kind of facilities. And surprisingly, we found the most high-risk area, they don't have enough this kind of heat shelter facilities. So we provide this kind of recommendations. And also by that time, in around 2023, our government, we have a policy address mentioned that we have to scale up capacity in coping with extreme weather. So we organize this kind of press conference and provide the key findings and recommendations to dealing with this kind of extreme weather, like the government should implement permanent support measures, service for the new normal, like the heat shelters. And then we have a third question. Because Hong Kong is a high-density city, so we are known this kind of urban heat island effect. But the problem is, for such kind of effect, is it intensified during extreme hot weather events? And if that is the case, what is the UHI-related health impact? Because if you check the literature, there is a different kind of findings of the UHI effect during the heat wave. For some cities, they found that UHI effect keep the same, no matter it's for the extreme hot weather situation or typical summer situation. Well, some case study from the Boston, they mentioned that this effect get intensified during the heat wave. So that is why first step we conduct this. For people not familiar with the urban heat island effect, it mentioned that the urban area will absorb the extra heat during the nighttime, and the rural area or the suburban area, because they have more greeneries, so they can release the heat absorbed in the daytime very easily during the nighttime, so they can cause this kind of temperature difference during the nighttime. And if you read the international report on the heat house, very often they have such kind of conclusion. They mention that heat waves interact with urban heat island effects, can produce an effect of greater than the sum of background urban heat island effect and heat wave effect. But the question is how much and where is it? So that is why the first study we conduct is try to investigate this kind of urban heat island effect during the heat wave. And we adopt the purest definition of the heat wave we define in the purest study. And we found that for the non-heat wave situation and heat wave situation, actually this is get intensified. And also we can identify the distribution of this UHI degree hours across Hong Kong. And then we work with public health researchers. We classify the UHI effect into 3 categories, like the low, moderate, and high. And so we can compare the different scenarios. And then we found that the area of the moderate and high UHI areas found a significant increase of mortality risk, while the low UHI areas have no such kind of significant temperature mortality association. However, even within the high and moderate UHI area, for the high area, actually they double the risk of moderate, the UHI areas. It means the heat really kills people. It really depends on the location where you are. Hong Kong Observatory established this kind of warning system back to the 2000s because they want to alert the public of the risk heat stroke, sunburn during the hot weather, but also advise the public on the relevant precaution measures. And they also, this warning linked to the opening of temporary heat shelter for the needed people. So by that time, they have this warning, and then they gradually add more details, like the hot weather special advisory. And based on our research, in 2021, we have this prolonged heat special alert. It means a few days of very hot days and hot nights. And then in 2023, we have a special alert, which is called extremely hot. That is try to protect outdoor workers. So when the temperature generally reaching the 35 degrees Celsius or above. And based on this, we work with Hong Kong Red Cross to do the real implementation at the community level. And because we have a map, so we can overlay their service network and identify the hotspot area and where is the people they need this kind of support. And also we link their service, create this kind of anticipatory actions on the extreme hot weather, so we can consider the different phases, like the preparation phase, and also the triggering signal will be the 35 degrees Celsius or above. And also they can have the early action phase and set up their rest stations according to the hotspot map. And then they can have a disaster on site and also emergency response to that. And apart from that, from the last year, actually we conduct this kind of a new campaign, try to reduce the high risk on hot nights, especially for poor family. So they work with local NGOs, different NGOs, identify the locations, and also try to see what is the community level facilities they can rely on. And also we know that first we have to enhance the poor people's awareness of this kind of early warning and let them use the available facility like the community living room. And if possible, we encourage them to turn on the air conditioning. So this is like a very simple comparison. And if they do that, and this person report there's no sign of the heat release sickness, well, for this lady, he report the sign of heat risk, heat sickness. And also you can check the before and after indoor temperature. Before is 30 degrees Celsius and after is 24. For this case, it's 31. So this is an ongoing, continuing project. This year we'll conduct a large campaign on this. And previously I talked about the heat-related mortality, heat-related risk assessment, and also I show this figure. So it's the physics tell us if there is an increase in mean, and the graphic, this curve will shift, and then we'll have more hot weather, more record hot weather. And also this talk about mean, if we talk of variance, i.e. the fluctuation situation, and then we'll have the more record of extreme cold, more cold weather, and more hot weather. But if we combine both, it's likely we'll have more the hot weather situation and less change for cold weather. But so it doesn't mean we don't need to worry about the cold. Actually not, okay? When I was in Tokyo in 2025, I gave a lecture at Tokyo University, and the day when I landed in Tokyo, the temperature is around 22 degrees Celsius. On that day is a Tokyo Marathon. And then one day later, the temperature dropped to the 6.2 degrees Celsius. And the early afternoon and also early morning on Wednesday, they even got the snow. So you can see there's a dramatically temperature change within one day or within 2 days. Well, this is not a single phenomenon. I checked the news. It talked about in the Sydney, they also experienced the cool down by 8 degrees Celsius in 30 minutes overnight, 8 degrees Celsius. And so that is why if we look back to say what is this kind of temperature variation, temperature fluctuation, and I use the annual data from Hong Kong 2023. So if the December is our winter, it's your summer, but for winter time you can see, let me explain this first. The orange color shows the temperature above showing the warm situation. The blue color showing the cold situation. If you compare the daily maximum temperature with this kind of last 2 decades smoothly daily average. And well, for the 95 percentile, it means the summertime is like the extreme situation for the summertime. Well, for the winter, you can see the most of the time we experience warm winter, the orange color showing that, but also sometimes we may experience a cold situation. In good old days, if we don't have global warming, and it means the temperature drop is from here to the bottom. But now we have warm winter. It means the temperature will starting drop from here all the way down, but they are not just going back to the normal winter, they're going back to warm winter. So this kind of drop is getting sharper, and also the situations is very quick. So previously, the first part of my presentation is talking about heat house. We finished that project around 2023. Now we are working on the cold house, but we have to work on this. The background actually is the global warming, still relevant to the heat. And earlier last year, 1 year ago, there is a paper published in the Nature Communication, and they're talking about how to account this kind of warm to cold temperature events in the warming winter. They use the temperature flip. So you have a warm situation, you also have a cold situation, but it's like a very quickly temperature flip from the warm to cold, from the cold to warm. And they use the standard deviation to classify this situation. We adopt the idea and running the data analysis for Hong Kong by using the historical long-term weather record back to the 1991 up to the 2024. And so first we found that in the good old days, we have this kind of warm to cold temperature events, and it's quite stable for the 4 or 5 occurrences annually since 1994. But over the past decade, they have slightly increased to more than 5 events. And then we also found that this event with extremely cooling rate has becoming more frequent over the past 3 decades. And also we found that this event not only happened in the typical winter months, but also in the early spring, the shoulder months of the season. And then with a significant increase in frequency during the March in the recent decades. And when we describe such kind of event, we're considering several metrics like the starting temperature, the daily minimum temperature on the first warm day of this event, and then the dropping magnitude, i.e. the difference between an event starting daily minimum temperature to the lowest daily minimum temperature. And then we're also considering the duration, i.e. the time interval from the first day of the warm period to the coldest day within the event, and also the cooling rate, i.e. the ratio of the dropping magnitude of every day to the last day, okay? And then we're running the pattern and the trending analysis, and we found that since 1994, such kind of event have showing the increasing intensity, a large temperature drop, a fast cooling rate, and a short duration. So it means this kind of situation getting more acute and also intense. And then we run this kind of dynamic health risk because it happens so quickly. So how people respond that? We adopt multiple health data like the ambulance dispatch data, hospitalization data, and also deaths. And we found that if we, at the beginning, we have this event, although this event not really triggering the 12 degrees Celsius cold warning system, but they still have this kind of vulnerable population, mainly the young people. And if this kind of situation continues, and we found that elderly people, they have a trouble, and eventually they can cause them death. So this is still ongoing research, but now we have a new collaboration, or we have some publication already. And then we have a new collaboration because this is not a single phenomenon in Hong Kong, and especially for the subtropical region, we don't have an indoor heating system. And basically how cold you feel from outside, indoor is the same, and probably even worse, and because of humidity. And then population in subtropical cities are more sensitive to this kind of health consequence of such kind of fluctuation because people get used to the warm situation or the hot situation. And then the existing cold weather warning system inadequate cover this kind of temperature fluctuation because they use a fixed number, this kind of triggering signal. So the dynamic of this kind of fluctuation, they not really capture that. So they not, but potentially they cannot really increase public awareness of this. So that is our ongoing effort on the global level. And so I want to say a few things. Like what I present today, although everyone know that there's a temperature rise 1.5 degrees Celsius or even 2 degrees Celsius, but problem is we really need to understand every fraction of the degree of warning matters and increase the climate extremes, impacts, and risk. And for my research, because it's like application oriented, so we are not just doing the pure scientific literature review. Very often we go to the NGO stakeholders, government, try to understand what's their real need and how we combine both in our research at the beginning when we prepare this kind of research proposal. And in 2023, the UN call for early warning for all, actually there are 4 pillars. So like the weather part, the Red Cross part, and also the meteorological information, how they disseminate this kind of information, how evaluate the potential risk, and also really do the preparedness and response to this. So I think for the public health or even the urban planning, we have to consider these 4 pillars together and see how we put this kind of scientific understanding, knowledge transfer to do some real impact on our society. And so based on my journey of this kind of collaboration with public health researchers or doing this kind of heat health or temperature-related health impact assessment, first I would like to say the climate change and its application is really complicated. So that is why the cross-disciplinary action collaboration are necessary and essential. And then we really need to not just do the scientific research, but also transfer these kind of findings to the real implementations and understand the real need from our society. And second one is we have so many big reports, global collaborative research reports, but we need this kind of urban scale climate change understanding and then we can conduct this kind of corresponding health impact assessment. Last one is every time we are not just showing the figures, numbers, or equations. We need to virtualize this kind of evaluation result for public engagement and policy making. That is very effective way to communicate and even debate. So that's all my presentation today. Thank you.
Great. Okay, is this okay working? Yeah. Okay. Chao, thanks so much for that. While people are thinking of questions, I'm just going to quickly ask a couple of my own, if that's okay. The urban heat island effect. I was really interested by the schematic that you showed that describes that, because I think often we think that ambient temperatures in the shade are amplified really considerably by the urban heat island effect. But I think in the schematic that you showed us, the one that's in the middle of the day, if we go back to that. So I was struck here. So the dotted line is the thing that matters, right? That's the air temperature.
Yes.
And so it seems as though that
one is dot line is air temperature. The thick line showing the surface temperature.
Yeah, well, I don't think we care about the surface temperature unless you're lying on the ground, right? Yeah. So we care about the air temperature from a human perspective. And so it looks as though the urban heat island effect isn't present in air temperature during the daytime. Is that right?
Actually, it depends on the specific hours. For example, if you refer to our study, actually we also conduct a cool island effect. So it's like because the thermal capacity, no matter for the rural area, trees, building mass are different. Yep. So it means they absorb the same energy from the sun, but the temperature patterns, increasing temperature speed are very different. So that is why if you refer to the previous slide, is showing for the rural areas, if you check this, there's a dramatically difference, but for the urban areas, quite stable. Yeah.
Right. Yeah, I think the point I'm trying to make is that I think often people think about surface temperature, and that speaks to your earlier point, is that a lot of the traditional work looks at surface temperature, but it's air temperature in the shade that matters in terms of...
That's true. Especially for Hong Kong, our average building height is 60 meters. And if you're talking about surface temperature, it means 60 meters above the ground. But people will live around the ground level.
If you take I think the standard measurement height, if you take air temperatures, is 1.1 meters. Because that's center of mass, I think. I think that's the standard way of doing it. Great. And then the other question I want to quickly ask you is about the temperature flip work that you're doing. That's true. Quick anecdote, if you think that an 8 degrees Celsius change in 30 minutes is a lot, we once measured at Melbourne Park during the Australian Open a 17 degrees Celsius temperature reduction in 85 seconds. So that's a pretty big temperature flip. But I'm just kind of curious about, a little bit about the mechanism. So what is it that is leading to this? And it sounds like it's a relative difference rather than an absolute thing. And the other thing it got me wondering is that, so what we're saying is that these temperature flips are potentially hazardous to human health. But I would think that people get much more severe temperature flips when they go from an air-conditioned environment to an outdoor environment on a hot day. So, how does that all kind of factor into your thinking on this temperature flip work?
Actually, I think you're talking about several different things or points. The first one is a mechanism of such kind of temperature flip. How that happened? Actually, in Hong Kong, we have running this kind of synoptic weather pattern, try to understand the atmospheric conditions, why or how eventually we have this kind of sudden temperature drop. And also running the long-term climate data analysis. For example, in Hong Kong, we are getting hotter and drier in the winter. And the humidity, they can going down to like the extreme case is 19%. But in Hong Kong, typically our humidity is around 60. percent in winter, but this one is going down to the 19%. Because of that, the temperature drop or temperature rise can be very quickly within 1 day or within a short period. And also the second one is background climate condition change. So for example, we found that originally in the wintertime dominant by 4 types of this kind of synoptic weather pattern, now emerged to the typical 2 types. And also because the background climate condition different, so sometimes we got this kind of strong wind, but also the temperature drop very quickly. And sometimes we have a strong wind, less strong wind, but also raining and the cold force of this kind of temperature drop. So it depends on the background climate situation or patterns. So that is the first step we do this kind of analysis. And when you're talking about this thermal comfort situation or even the heat stress or temperature related stress, I guess, for example, when people, it's quite typical, even in Hong Kong, so we have this kind of freezing temperature inside, like the 18 degrees Celsius, but outside is
freezing
like
zero, but
yeah. And then people, I think Professor Richard Didier worked on that. It's called a thermal anesthesia or thermal delight something. And so when you, although the outside is hot temperature, but inside is pretty cold, when you go outside, at the first moment, you really embrace this kind of hot temperature, and then your body get to that, and then you cannot tolerate that. There's a process. But I guess for this kind of outdoor temperature drop, it's quite different because it's constantly drop, and also very often come with wind.
Yeah, so I think a lot of that is describing why the flips are happening. But I'd just like to push you a little bit on this.
Okay.
Why does it have, in your thinking, a negative effect on health? So, so the reason it would affect health is because the way it affects your body.
Yeah.
So I'm just trying to get a sense of, why would this be harmful to health?
First, I guess everyone have this kind of personal experience. You notice suddenly you have this kind of temperature drop. And also we got a lot of complaints from the elderly because our second part of the study, we also involved this kind of elderly people. They said, okay, although today is still 20 degrees Celsius and 18 degrees Celsius, but they really feel such kind of temperature drop, the impact on their health. Yeah.
But they're describing changes in thermal comfort, right? Are they describing impacts on their health? And if so, what is leading to that? I think that's what I'm trying to get at.
I don't know the details, to be honest, but they start complain like they feel that knees getting more pain, and also the back, etc. But basically they complain this. And so that is give us a motivation to do a further study.
Sure, okay. Yeah, I think the translation from those types of ailments to hospitalization and death, that's a big leap, isn't it?
Yeah,
so I think it's something worth further exploring is what the physiological plausibility of this.
Yeah, that's true. That's why I came to you.
Right, fair enough. Okay, well, I don't know if we're able to figure it out for you, but we'll have a go. James, did you had a
You beat me to it.
I beat you to it. Okay. So Lai Hang, I was caught on my eye, saw Lai Hang, and then we'll come to Kim.
I was going to ask a similar question about how this temperature flip actually causes health impacts. So for example, I guess someone with cardiovascular conditions, if there is a big drop or up, your body will have to work a bit harder to kind of retain homeostasis or kind of. So but if it's only happening for such a short time, maybe the long-term health impacts will be not so strong. Just wondering whether you have any literature that actually tracks this flip and
actually, if you check the literature, they do have different kind of indicators try to capture this kind of event, like the daily temperature difference, temperature change within 2 days. They do have this, but they just capture that one, not really an event. I think that is a difference from our study with comparing to the previous studies, because we consider like an event. So it's like a consecutive, this kind of temperature drop situations. And also we check the background temperature situation, i.e. it's like a warming winter situation. That is also slightly different from the previous study. Yeah. I'm not sure whether I answer your question, but we do have a paper. We have done the literature review. Okay. Yeah. So, this one, the cold weather pattern health impact across the climate regions in a warming wind, a systematic review at a global scale. Yeah. But basically, they are talking about like the fixed this kind of number of temperature drop, not really dynamic situation. But now what I'm talking is like we have a quick drop, less duration, and also this kind of starting from warm winter background. So this is like a new phenomenon. So that is why after we done the literature review, we found that we can do something new or something never done before. Yeah.
Okay, so we've got Kim next question.
Hi, I'm a general practitioner, and so part of the reason, with my patients, when it's cold, if it's an old person, they just stay in bed because it's too cold. Part of it is their behavioural adaptation to cold is just to keep warm in bed, so they don't move.
Mm-hmm. Yeah,
and I've
yes,
had patients
that's
who
true,
just don't get up and cook and eat because it's just too cold and they can't heat up their house adequately. So when there's this variation, it's very hard because I have a lot of over 65-year-olds, some of them living alone, who actually are in such thermally inefficient houses that, like, I've done a lot of stuff on heat waves, but it does get cold. So just from a patient point of view, having been in a lot of house calls, I can see why people die during the cold.
Yeah.
It's a comment.
Oh, thank you. So actually in Hong Kong, also local researchers have done this kind of cold house studies, and the cold actually generally will kill more than the heat. So in Hong Kong, we have this kind of findings, but still they use a kind of traditional understanding of the cold, not really this kind of dynamic situation. Yeah.
Just one quick comment here is that I think we need to be careful of the underlying causes, or taking into account of the underlying causes of cold-related deaths.
Yeah.
Because cold-related deaths are, I think the majority of them are not direct hypothermia, but increased risk of infections and things like this.
Yeah. But it's also how people behave. People who actually have concurrent. We have about, say, 60% of our population of practice, have about 4 comorbidities. So really, with people, so many people who survive their heart attacks with heart failure also have a problem during cold as well. I'm just saying people just live in precarity. So regardless of what they have, they're at risk.
Yeah.
Absolutely.
So because the cold health part, this project is still ongoing. And for our team, we do have a psychology professor work on that part, the mental health part. For the heat health project, we finished in 2023. And according to the heat health findings from psychology perspective, they noticed that 1 week before they report the physical health issue, their mental health issue already gradually become bigger or appear this kind of mental health issues. So that is why when we work with Hong Kong Red Cross NGO, we try to have this kind of social influence on their mental health part, try to encourage them to have this kind of social activities, and also have some support, this kind of mental health support. Yeah.
James.
Hi. Sorry to ask another question about the temperature flip events, but I think it's a really interesting concept, and you described it very nicely. I think most of the data you showed us was around when temperatures go from fairly high to low pretty quickly, and that seems to be a problem. Is it also a problem the other way around if you start off with fairly cold temperatures, maybe perhaps in the morning, and then across the course of the day you encounter extremely high temperatures?
Actually, it's really going back to see how we account this kind of event. So we use a standard deviation first to try to capture this kind of warm side and cold side, and then you identify by the 75% of the cooling rate. So we only focus on that. But according to the previous literature review, the cold house, what you mentioned, this kind of typical or normal situation, the cold house, it also kill people. Yeah. But
so if you just go back to the previous slide, if you don't mind.
Okay.
So where do you see most of the direct health impacts of these flip events? Is it at the bottom when it's really cold, or is it at the peak when it becomes hot?
Okay. We have a paper. Actually, we do a comparison. Your question is, I'm not sure whether my understanding is correct. So we have some event. They are not really triggering the cold warning situation, but still have the temperature drop, right? And also we have some event that eventually triggering the warning signal. So we do a comparison. Even the part that are not really dropped to the warning signal, triggering the warning signal, they still have a health impact. So we have done that part analysis. Yeah, and the findings. This one, the dynamic, is still under review, but also you can check the first one, increased mortality risk of winter temperature flip, this paper, yeah.
What about the warming though? I think is that what you're asking, James? So you're talking a lot about the cooling? So
yeah.
The temperature flips, so we've been warmed to being cool.
We haven't done that part yet. Yeah, we haven't, no. There's definitely a warming part, or drop, or increasing part, but we haven't done the analysis yet.
And just so I understand, so the way in which you've done the analysis is looking at daily highs, is that right? And daily lows?
Daily minimum temperature. Because we're running a sensitivity test and we found that only daily minimum temperature have a high association response to the mortality data. Yeah. Because
the temperature will increase or drop relatively quickly throughout the day, right?
Yeah, that's true.
So it's just from day to day that you're finding this?
Yeah.
Okay. Do you have any other questions? I can ask another one if you want to ask a question.
Okay.
If we go on to the work that you did looking at hot nights, I'd like to get a better understanding in your mind of why do we think that hot nights are potentially more dangerous than hot days? And again, if I'm thinking about what happens to the body or behaviorally, I think is probably
very
a key
simple.
to this as well.
During the daytime, if you feel hot, you will do some behavior change, right? And naturally, you're looking for some cool area. You can put your jacket off. You can do some behavior change. But nighttime, basically, you just sleep there. You won't move from outside, from your bedroom or from your bed. And if the bedroom temperature is too high, although sometimes you may sleep, but you'll not get a high quality sleeping situation. And even you sleep after 6 hours, 7 hours, your body still feel like very tired, not really recovered.
Yeah, I think we need objective data. So I think we hear a lot about overnight temperatures being high, being more dangerous than daytime highs. But I think the area is lacking a bit of objective data on what is happening to people in these circumstances. So if we think about a hot night being defined as 28 degrees Celsius, you would still have a decent temperature difference between the body and the air. Yeah. So you would, especially if you're using fans or something like this overnight, you would still have enough heat loss for your internal body heat storage to return to what it would be at baseline.
Yeah.
So if the mechanism is potentially disruption of sleep, then I can understand. The thing is that I guess we then expect to see disrupted sleep probably aggravates the risk of certain types of mortality, maybe cardiovascular, for example, but maybe not other types of mortality. So I'm just wondering if that linkage has been made at all.
Yeah. I don't know if anybody, because I know some experts, they're focusing on the sleeping quality. For example, from UC Berkeley, Stefano, Stefano, I forgot his family name, sorry. He have done this kind of sleeping quality monitoring. On one side, they measure the bed temperature, the air temperature, and also the body temperature, and also ask this kind of objective question before the sample, the people go to sleep and after sleep.
But I think the point I'm trying to make is that the disruption of sleep, the link between that and the type of data that you're describing there, and people dying,
I know,
it's a big leap.
Right? But in general, I think because if you have several consecutive hot nights and you cannot sleep very well, in general, your immune body system is going down. And if you have some poor health conditions, maybe have problem.
Yeah, I think this needs to be objectively demonstrated.
Yeah, yeah.
I think it sounds right and it sounds plausible and it's good for hypothesis forming.
Yeah.
But I think more work needs to be done with the objective measures on these things before we're actually drawing these conclusions. But that's obviously a great area for more research. Like Heng's got another.
Not quite a question, but it's more. There have been studies done on shift workers about sleep disruption and longer term morbidity and mortality. So that would be quite a worthwhile thing to look into. But aside from immediate mood disturbance that maybe causes you to drink a lot and be more violent. So there's been studies done as well. I'm not sure that that timeline can be shown by a short-term study. You actually have to follow up this cohort. So it would be worthwhile to actually have a cohort that you follow who live in these hot conditions and see whether they die prematurely because of heat in sleeping.
Long-term study.
Yes, but why not? I mean, they have done cardiovascular mortality studies that are really long-term. You're tracking them anyway. Because I think short-term impact of broken sleep because of hot nights, from what I have read, doesn't cause immediate health impacts. So except for the behavioral part where you might become more suicidal, you might become more likely to drink, more likely to hit your partner.
It aggravates specific types of mortality, right? You think?
Yes,
Real quick,
Real quick.
Okay,
With these.
Sorry, I got the wrap. Let's wrap it up.
Sorry, I will be very quick.
Okay.
Just in terms of the sleep loss question, based on the data that you have analysed, do you have any idea of how much sleep somebody needs to lose on a hot night for it to become a problem? How many minutes or hours?
No, but actually we'll conduct a new study, try to understand those kind of poor families, measure the indoor temperature and also measure the objective, this kind of feedback according to their sleeping quality. I will try answer your question next year.
Great. Okay. So if we just finish up with a final round of applause for Chao. Thank you, Chao.
Thank you.
And that's a wrap.
I think I like the question part. That is why I came to public health people here, and I came to this kind of potential collaborations. Okay. Thank
Great.
you.
Okay. Thanks, Chao.
Thank you.